Good day, everyone. You're welcome to yet another episode of the Yaba Voice webinar. We are happy to have you join us today. This is the month of October, and gradually the year is running to a head. I hope you've been good. And again, this month of October, it's also the mental health month. And so we had lots of activities that were lined up. I'm going to tell you one at the end of it. Please just remind me that I said something special happened this month. I'm going to share that with you before there because you need to be able to grab your copy of what happened. I will tell you about it at the end of today's webinar. And so you're welcome. I hope it's a beautiful day wherever you are joining us from. It's a beautiful day here in Lagos, Nigeria, Yaba precisely. And we're talking about the Federal Neuropsychiatric Hospital, Yaba, Lagos. All right, so before we run into the webinar proper, the medical director was here to welcome us formally, Dr. Lubinga Adekile Owoye. Over to you, sir.
Yeah, thank you, Mrs. Kemi Akitoyese, for that warmly welcome. Good afternoon, everyone. I welcome all of you to this month edition of the webinar by Yaba Voice. As you all know, Yaba Voice is a platform for mental health education, advocacy, and community outreach. Not that alone, it is a social media platform of Federal Neuropsychiatric Hospital Yaba Lagos, through which the hospital creates awareness and educates the populace on the topical mental health issues from time to time. Today's topic is mental health and emotional well-being, raising the stakes. According to the World Health Organization, health is a state of complete physical, mental, and social well-being, and not merely the absence of diseases or infirmities. Meaning that health is maintained on aforementioned tripod stand: the physical health, the social health, and the mental health. Therefore, no health without mental health. During the World Health Assembly in May 2021, governments from around the world recognized the need to scale up quality mental health services at all levels. Why did they have to do this? One out of every 4 people has mental health issue or the other. 75 to 95% of these people has no access to quality mental health services. You can see how important mental health is. So in today's webinar, there are many questions to be addressed. What do we understand by mental health and emotional well-being? How important is this mental health? What are the factors that can compromise our mental health? And how do we maintain a very sound mental health? To address this issue today are great mental health experts in the house. The first is Dr. Temilade Adunoyi Adegbite. Dr. Adegbite is a consultant psychiatrist with special interest in child and adolescent psychiatry. She has a basic medical degree from the Ladoke Akitola University and fellowship in psychiatry from the National Postgraduate Medical College of Nigeria. She is currently running a post-fellowship training in child and adolescent psychiatry at the National Postgraduate Medical College of Nigeria. She is married with beautiful children. The second speaker in today's webinar is Mr. Francis Akikomi. Mr. Akikomi is a therapist, a researcher, and a seasoned clinical psychologist. His area of expertise include, but not limited to, managing children, adolescents, and adults with emotional and behavioral challenges. Mr. Akikomi holds Bachelor of Science in Pure and Applied Psychology as well as Masters of Science in Clinical Psychology from the prestigious University of Ibadan. At present, Akikumi is a doctoral student at the University of Ibadan. He is a licensed clinical psychologist and a registered member of the Nigerian Association of Clinical Psychologists. Currently, he is an assistant director of clinical psychology at Federal Neuropsychiatric Hospital, Yaba, Lagos. He is the author of the book, Living Well and Healthy with Emotional Intelligence. Kindly relax and listen to our mental health expert as we promise you a rewarding session of today's webinar. Thank you. Over to you, Kemi Akitoyesi.
Thank you so very much, the medical director, for that arousing welcome. The medical director had reiterated the fact that there are no better times to talk about the issue of mental health than now. With everything that had gone on in our world post-COVID, honestly, this is a conversation. And I'm proud to say that at Yaba, the Federal Neuropsychiatric Hospital, anchored by the Arrow, who is Dr. Olubenga Dekele, we are championing this, and we are saying we must raise the scale when it talks about mental health awareness. And that's what Yaba Voice is all about. That's what we've been doing for over 2 years, and we are still going stronger because we know that until we are able to achieve this mandate, there is no stopping. We must ensure that everyone around the world hears this message and they are able to maximize every information that's been sent on this platform. So like the medical director has said, we're looking at mental health and emotional wellness. We're talking about raising the stakes. How do we do this? But before we get into raising the stakes, we need to understand what exactly is mental health and emotional wellness. Dr. Adegbite will be doing justice to that for us. Dr. Adegbite, over to you, ma'am.
Yeah, good afternoon once again. I want to sincerely thank the organizers of the program for the opportunity given to me to talk to us today. Once again, my name is Temilade Adegbite. So talking about emotional wellness or talking about mental health, emotional wellness can be said to be being with all your feelings in a way that is kind, that is curious, and is non-judgmental. We're trying to say that, being in charge of your own feelings that is satisfactory to the individual that is having the feelings. It includes giving a positive thought, emotion, and ability to deal with life challenges. And when we're talking about life challenges, they can be positive, they can be negative, and it ranges from things like loss of job, loss of loved ones, properties, other life events, birth of a new child, getting a new job, promotion in the office. For as much as possible, all these things we're saying, giving a positive thought and emotion and ability to deal with all life challenges. World Health Organization in 2004 defined mental health as a state of well-being in which an individual realizes his or her own potential. They're able to cope. They are able to cope under normal stresses of life. They can work productively and fruitfully, and they can make contributions to their own community. So emotional wellness is under the umbrella good mental health. And there is no health without mental health. Let's talk briefly about the epidemiology of mental health conditions. What the organization estimated that 1 in 4 Nigerians suffers from mental illness. Don't forget that when the CMD was talking the other time, he mentioned that, it's not just, mental health is not just mere absence of disease or illness. It has a lot to do with your emotions. It has a lot to do with your perception. It has a lot to do with your thoughts and your own behavior in the environment. And it is said that less than 10% of Nigerians have access to mental health care. We can say that the burden of mental health in Nigeria is actually huge. Thank you.
Thank you so very Thank you so very much, Dr. Adebite. And Dr. Adebite had told us what the World Health Organization had talked about when you talk about mental health. Yeah, we would share comments and every other thing. We'll respond to all of these comments coming in at the end of today's program. But please, if you know someone that needs to be here, like I said, what we are talking about today is huge. And so it's not something that we can just play around with. It's important, emotional wellness. And this has nothing to do with somebody being mad or, like we would always just presume when we talk about the issue of mental health. So it's important, please, if you know somebody that needs to be here, send a link to them, or they can join us on the Facebook page of the Yaba Voice and get on with this conversation. Now we're going to be moving on and talking about the determinants of mental health. And with this, we will talk about the causes, what are the risk factor, what are the protective, what can make somebody vulnerable to having mental health. Mr. Akikumi Francis is here to share that with us. Over to you, Mr. Francis.
Thank you, Mrs. Akituye. It is my pleasure to join in this presentation. Good afternoon to everyone there as we proceed with this presentation. There are several factors that will mar the mental health of an individual. One of these factors is childhood experiences, the presence or absence of unpleasant childhood experiences could determine the mental health of an individual. And consequently, an individual.
Mr. Francis, we can't hear you. We're sorry about that. All right, so while they're trying to rectify that technical issue, I recall that when Dr. Adebite was talking earlier, she mentioned the fact that 1 in every 4. I think for me, that's very scary. That's very scary because that indicates that when we're talking about the issue of mental health is really, really prevalent in our environment. Now, Mr. Akikumi Francis is back. Over to you, sir.
Sorry for that break in transmission. What I mentioned earlier on was childhood experiences. The presence or absence of unpleasant or traumatic childhood experiences could go a long way in determining the quality of mental health of an individual. Childhood history of abuse or neglect could trigger mental ill health. Whereas an individual who has a very pleasant, favorable childhood experiences could later on become an individual with healthy mental health. Another factor that also plays a significant role in determining the mental health of an individual is family history of mental illness. Having a relative or parents with history of mental illness puts such an individual at risk of mental ill health. Just like having parents with diabetes and hypertension put their offspring at risk of this condition, same way children of parents with mental illness are at risk. In another development, individuals exposed to substance abuse, such as alcohol abuse, cannabis, and other harmful chemicals, substances can trigger the onset of mental ill health. It is also important for me to talk about stressful life situations, such as undue financial problem, death of a loved one, or divorce experience perceived as stressful could be a risk factor for mental ill health. What about poor parenting style? Individuals who were raised in an authoritarian parenting style, an unhealthy one, of course, could also be at risk of mental ill health. Children or individuals who experience head trauma while growing up or not quite long after birth could also be having mental ill health later in life. What about prolonged labor? Children who experience prolonged labor are at risk of mental health challenges and other complications such as intellectual disability, autism, etc., etc. Then availability of social and emotional support. This, of course, is a protective factor against the development of mental ill health. The availability of social and emotional support for an individual goes a long way in helping an individual to maintain good mental health. And also let me talk about dysfunctional family characterized by domestic violence, emotional and sexual abuse, put members of such family at risk of mental ill health. The list continues like that, but it is sufficient at this time because of time for me to mention those ones that I have aforementioned. Thank you.
Thank you so very much, Mr. Kikumi Francis. You know, when he was talking about childhood experience, parenting style, and other things like that, I was asking myself, it means that a lot of us are not free from all of those things. Definitely a whole lot of us may not be free from when we talk about mental health issues. Maybe, just maybe. That's why we are having this prevalence in our world today. Because when you look at the childhood experiences that some of us had, I'm not talking about me particularly now, but I'm talking about people generally all over the world. It's really severe for quite a whole lot of people. And again, this also is very germane to the fact that people need to begin to put into cognizance the issue of intentionally raising up children. I think that's some of the things that we need to also talk about, and maybe subsequently in our webinars. Intentionally begin to build up the emotional life and strength of your child so that we won't have this kind of problem at the end of the day. Now, we'll just be talking about it, and then we'll be looking again at how does emotional wellness affect our mental health? Is there a link between, yes, I'm emotionally well, and then mental health, and then what are the signs of distress? How can we know that this individual is distressed or not emotionally well? Or how do we say it? Dr. Adegbite, can you help us with that?
Thank you, Mrs. Akitoye. Yes, like I said the other time, I said that mental health is like an umbrella on emotional wellness. And we're simply saying that, our thoughts, the way we feel affects the way we behave. And many of the times, some of the behavior we exhibit, these are the signs and symptoms that people around who are mentally healthy, this is what they see. And this is what sometimes we call signs and symptoms of mental illness. And these signs ranges from, in severity, they may be slightly different in different age groups. For example, in children and adolescents compared with, a young adult and adult population. And when we are talking about common signs and symptoms of mental illness or signs and symptoms of distress, it might be things like poor sleep, sleeping poorly, reduced need for sleep. Some have poor concentration, loss of interest in usually pleasurable activities. Somebody is known to be an happening guy, and all of a sudden the individual is just withdrawn to self. He's not interested in talking to anybody. Sometimes they're absent from work and you are wondering what's happening to them. And some men, especially, may actually go on to, people may want to use alcohol the more, or smoke cigarettes, or use other psychoactive substances. And other symptoms are things like reduced energy. Others might have hyperactivity. They may become restless. People have racing thoughts. They may want to get themselves involved in so many things at a time. Some have weight changes, which can be in form of weight gain, and it can also be weight loss. Some may want to eat more than usual, and some actually have loss of appetite. Others have voices of people that they can't see in clear consciousness. Sometimes people have unusual belief. People are after me, they want to kill me, they want to take my glory, things like that. And many of the times in our environment, we link all these things to spiritual attack. And instead of running to the hospital or getting a specialist to review, we prefer to run to churches and mosques. We run to our Islamic clerics and all that, because they actually believe that they are not signs and symptoms of mental illnesses, because they feel what they have is spiritual problem. Sometimes in children, the symptoms may not be as straightforward as in older adults. When children are depressed, they may actually not have, persistent low mood like that. It might just be on the irritability that you don't understand. And in very young children, they might just not interested in going to school refusal. It might be non-specific symptoms such as abdominal pain or headache that you can't link to everything. They have done all investigations, we just can't get the link to what is causing the problem. It's good that we seek, specialist evaluation. The child might be suffering from what we call childhood depression. Sometimes they are unduly, they are unduly clingy to their caregivers or to their parents. And the symptoms, we can continue to talk about the symptoms of mental health problems. And of course, not only that, in children and adolescents, symptoms of, things like mental health conditions such as attention deficit hyperactivity disorder or problems with autism spectrum disorder. The child might be socially withdrawn, is not interested in other children around. They have problem with communication. They may be restless. They might be hyperactive. They may have difficulty awaiting their turn. They may lose their things. They may have poor concentration. They may not be able to focus on anything. Even their academic performance is also affected. They may not be able to follow through, following through an assignment and getting it done. They may not be able to focus and do their assignment. And if we continue to talk about all these things, the list is on end. So these are just the few ones that I would say that I'm able to mention this time. Thank you.
Thank you so very much, Dr. Adegbite. And you know what excites me from what you had said is the fact that children also may exhibit certain symptoms or signs of mental health. And if you're not aware, if you're not informed, that means we would put pressure on them. And then we'll either beat them because they don't want to go to school, we'll call them liar, and then it now makes it to look worse and more difficult to manage at the end of the day. And that's really getting at me, because it means that we must pay attention to some of those things. So when a child who usually would go to school with joyful manner, be playful and everything, just all of a sudden decides to say, I'm not going to school, I don't want to. The resulting effect shouldn't be shouting, screaming, and every other thing. Now, that means we need to be more intentional about finding out what exactly is the problem and how do we deal with all of those things. Thank you so very much, Dr. Adegbite. Like I said, if somebody needs to hear this, let them understand the need to be heard. And then we would also, they can also join us on the Facebook. And please, you could send in your questions and then we will be able to take them as we go on in this conversation this afternoon. All right, so Mr. Kikumi Francis, how do we maintain mental health and emotional well-being vis-a-vis all that is going on in our world? How do we maintain mental health and emotional well-being? Since we have said mental health is the umbrella body that covers emotional well-being. So how do we get to maintain our emotional wellness in the midst of all of this? Thank you, ma'am. Thank you, sir. You should unmute yourself. All right, sorry about that again. All right, so why that is also being resolved. Sometimes some of these things happen. Okay, all right, it's up now.
Thank you, Mrs. Kintoyeshe, for the question you have raised, which we want to elaborate upon now. So how do we maintain mental health and positive emotional well-being? One of the steps an individual can take to maintain good mental health is talk to someone. Talking to someone you trust, whether a friend, a family member, or a close individual that can help. You are likely to feel better if you are able to openly share what you are going through with someone who cares about you, instead of bottling up the emotional experiences. Another very good ways of promoting our mental health is to manage our emotion. In other words, using emotional intelligence. We must learn to be aware of the emotion we are having, how to identify that emotion, how to read that emotion, as well as understand and manage the emotion, as well as the emotion of other individuals. Being able to manage our emotion will go a long way in helping us to be emotionally healthy. Also, we need to accept situations that we have no control over or that we cannot change. There are certain situations that comes our way that we have no control over them and we cannot change them. But the best way is acceptance. And when we accept, we can now go about looking for certain solution either within ourselves or from other people. Then, if in a situation there is no solution at all, then we have to learn to live with that situation, and that will help us. Then, one other factor that will help us to improve our mental health and maintain it is look after your physical health. Taking care of your physical health help improve your mental health and well-being. For example, be active for at least 30 minutes daily, whether that is running or walking or whatever activities you know you can do. Eat balanced diet also and have a good enough sleep will go a long way in helping you. Another thing again is that at every point in time, look at the good side of every situation or event that happened to you. Every event that happened are not totally bad, are not totally dangerous. There are certain good side of those situations that if you look at it, we go a long way in helping you to move on and to have a good mental health. Then avoid undue stress, either at work, at home, anything. You must understand your elastic limit. So anything that can unduly stress you, must ensure you avoid it. And also know your strength, your weaknesses also. This also plays significant role in helping us to maintain good mental health. Then do activities that you enjoy. Try to continue doing activities that you find meaningful and enjoyable, such as cooking for yourself or your loved ones, playing with your pet, walking inside your compound, reading a book, singing, watching television, etc. This can also improve your mental health. Furthermore, stay away from harmful psychoactive substances. Don't use harmful substances such as alcohol, tobacco to cope with whatever you are feeling or experiencing, because at the end of the whole thing, though these substances may give you temporary relief, the end of it is usually disastrous. Furthermore, take 2 minutes to focus on the world around you. This helps free yourself of constantly thought and so many other things that are bothering you. When you focus on the immediate experiences around you, this is called mindfulness. And take 2 to 3 minutes deep breath could go a long way in helping you to practice mindfulness. Then you can also be mindful of things around you. For example, what are the 5 things that you can see? What are the 4 things you can hear? What can you smell? Be mindful of all these things, being in moment-to-moment awareness, forgetting the past and not troubling yourself about the anxiety of the future will go a long way. You can also seek professional help in a situation whereby your personal resources is inadequate. Professionals such as clinical psychologists and other mental health professionals like psychiatrists, etc., could go a long way in helping you, working with you to manage the situation, and your mental health will be much better. Thank you.
Thank you, Mr. Francis. Let me just share with you what I did on Tuesday. And so on Tuesday, I was on shift on Friday. On Monday, I got home very late. I was tired. I went to bed without eating. On Tuesday, I got to work. there was nowhere to get food. Okay, so one of the big things that is happening in Yaba, let me just hint you, is that there's so much work going on in the federal union. I'm happy to blow our trumpets. When you say blow trumpet, I'm happy. But then because of that, usual place where we get food, we couldn't. And then I got back home very tired. Mr. Francis just talked about taking care of your physical health. And I said to myself, I need to be able to take care of myself. And so I went into my freezer, got meat out, diced it very well, tiny bit. I just made something very delicious. My children were looking at, are you making fried? I said, I'm not making fried rice. It's just Indomie, but I'm going to put all the condiment. I took it and I took a glass of milk, and man, I was very okay. And then I went to bed. By the time I woke up on Wednesday morning, I was really revitalized. And most times, a whole lot of us let ourselves go. It's important, even when there's really little resources to use, please take care of yourself. It's very, very important. I know one of the things he said, and he's still going to come back and talk to us about it more, because we need to understand something about this emotional intelligence, self-awareness. He was talking about self. He needs to also tell us so much about it before we end this thing, because we need to really get in tune with ourselves. We need to get in touch with ourselves to understand who we are, and then how to be able to bounce back in the midst of all of those things. Thank you so very much for that, Mr. Kikumi Francis, because it's very good. And now he said, look at the good side of every situation. And that's usually very difficult for a lot of people to do. How will you begin to look at the good side when things are not moving on very well? But then again, when you look at the positive, the minus tends to decrease, and then you're able to push through. All right, so Dr. Adegbite will be sharing with us, how can we promote the issue of mental health in our community? When we look at the so many challenges that are there, people don't want to come to psychiatric hospital. People don't even want to talk about it. Like I said when we started, the issue of mental is not something that a lot of people want to talk about. And so how do we want to promote the issue of mental health? Because we're talking about raising the stake. We want to create more awareness. We want to create an avenue where people are able to come in to the hospital and have the best of treatment and care and not feel ashamed, because it's also very, people have stigmatized this so very much. All right, so sorry, Jibola, for the audio. I don't know, maybe you could log out and log in again, and then maybe you will be able to hear us at that time. But I'm very sure that quite a large number of people can hear us on this platform. Okay, all right, so Dr. Adegbite, how can we deal with the issue of promoting mental health in the community? Over to you, ma'am.
Okay, thank you so much once again. So when we're talking about promotion of mental illness, we say that education is very, very key. A lot of times, people don't know, they are not aware of signs and symptoms of mental illness. So we're talking about psychoeducation. We go to schools, we go to churches, mosques, community, and we let them know about common signs and symptoms of common mental illnesses, so that people are aware about these symptoms and they're not just attributing them to spiritual attack. So right now we're talking about incorporation of mental health into schools curriculum, where children from schools can be taught about signs and symptoms of mental illness, what they can do to promote their own mental health, just like we had physical health in those days. We're also talking about, involving stakeholders engagement in form of organizing seminars for teachers, for imams, for pastors, for kings, for chiefs in the community, so that all these people can get to know about mental illness. I can say that awareness is getting better, but sometimes I see some cases and I still feel that, of course, sometimes I feel that we're not doing enough. Yes, these days we now talk of work mental health programs, where organizations, where companies, where public organizations are inviting psychiatrists and psychologists to come and talk to them. And sometimes not just to talk to them, they also have to, make some form of assessment or probably screening in form of using some questionnaires. And in some places, they actually have pre-employment screening questionnaires. Apart from that, we also encourage empowerment programs, especially for the vulnerable, the children and the women. Women empowerment is very, very important, and this is key in promoting mental health in the community. Apart from that, we also talk about anti-discrimination programs. Some of the times I have clients that the question they're asking me is, doctor, do you mean that I'm mad? And I also let them know that if you are using the word mad, I can also tell you that I am not a mad doctor. I am a psychiatrist. So people need to know that we need to discrimination. We need to demystify. We need to let people know that mental health is real. And sometimes we let them know that the only person that is exempted is somebody without a brain. That's the person that cannot have mental illness. So we encourage people to come up, to get to talk to their therapist. And we have a lot of them, not just in the hospitals, in the private sectors, online, and everywhere. What are the challenges of mental health in Nigeria? The burden of mental health alone in Nigeria, like when I was talking the other time, I mentioned that 1 in 4, the burden is huge. And I'd also mentioned lack of awareness on the part of the people, Nigerians. Those who are aware, some of the times, like when Dr. Weye was talking the other time, he mentioned that about 30% of the people who have mental health problem have access to mental health care. So lack of awareness is there, lack of access to care is there. In fact, lack of poor funding. This is Nigeria where people go to the hospital and they pay out of pocket. There's no NHIS. And sometimes they will tell you mental health conditions are not covered under NHIS. And when they are covered, they might tell you that, patients can only stay a few days in the hospital. When we all know that many of these psychological conditions runs chronic course, and they are not like medical conditions where people go to the hospital, stay for a week or two. So issues of payment out of pocket is another problem. Shortage of psychiatrists in Nigeria and other supporting staff. I can tell you day in, day out, people are checking out of Nigeria. And the ones that are remaining in Nigeria, they are concentrated in the urban centers. And we have a lot of people in the rural areas who need mental health services. They don't have access to them. Issues of brain drain, that's another problem. And then issues of mental health bill. As we are talking, we don't have a mental health bill in Nigeria. Looking at all these things together, we can say that, the burden, issues of funding, issues of awareness, issues of, access to good mental health care, shortage of psychiatrists and other mental health support staff, this is the problem in Nigeria. And I can only say that we're really hoping for the best. May God help us. Thank you.
Dr. Adegbite, the problem. So as I said, we are hoping for the best, and then we keep just hoping, because when you look at the state of, when people are just out there, and it's like there is no, sometimes I think about a week or two ago, they talked about a man who had been locked up for about 20 years, and they just brought him out, and then you begin to wonder, 20 years of somebody's life gone like that. I know he's not functioning, he hasn't functioned, he hasn't lived. And when you hear people's story about what had been done to them and how they had been, in a way, maltreated, and then you will just begin to wonder, how do we get out of all of those things? And Dr. David is right when she said it's psychoeducation. We need to get people to be more aware of the things. There are lots of myths when you talk about mental health illnesses. People will tell you about different things. Oh, it is this, it is that, it is this. But a whole lot of these things are very erroneous. They're not correct in any way. Yes, churches help, pastors are good people, but they all have their own job responsibility. It's not about doing the work of a psychiatrist or a psychologist. They can't take over the place of mental health institutions when we talk about all of these things. And this is very, very germane to what we are discussing today. And as soon as we notice the signs of this, the first point of call is getting them into the experts who can help them. So community awareness is very important. And everyone on this call today is an ambassador, because we need to be able to go out there and be able to pass on the message, pass on the information when we talk about mental health. Some people will believe that some of us working in the psychiatric hospital, we are not okay too. They will even tell you that some of you too have mental health problems. That's why you can work with them. This is very erroneous. How can somebody look at me and say, yes, no, it's not possible. But That's just the myth out there. All right, so I'm going to just take a bit of comments on the platform before we now begin to think of wrapping up this afternoon. All right, from Abe, he said, good afternoon. Please, can we have any content or details of a mental health session? Oh, that's what we do. The Federal Neuropsychiatric Hospital, Yaba, Lagos, is a mental health service providing organization. And you know, one beautiful thing about the Federal Neuropsychiatric Hospital is it's an embodiment, a total compartment of very many things. So we have the doctors, we have the nurses, psychologists, occupational therapy, social worker, even if you need to be able to use the gym facility, the laboratory, the pharmacy, and very many to look. We have all of this enclosed in one setting, and that makes it very easy for people to be able to access care in this facility. Ayorinde Mojisola Margaret says, I'm happy to be here. We're also happy to have you here. Otto, I hope you have been able to get the volume, but I'm sure that this is working perfectly. Okay, so Uzizi said, let it go. All great coping skills. Yes, thank you so very much for that thing. Yes, that was when Mr. Francis was talking about mechanisms and how to deal with all of these things. Anita said, thank you so very much for the point. Caroline Ojo just says, well done, Yaba Voice, for this insightful webinar. Thank you so very much. You're welcome, ma. We're happy to do this over and over again. Selifat Giwa says, mindfulness is very important. Thank you to our presenters. So presenters, thank you so very much. Jibola, okay, I think I've addressed that. Chris says, thank you, very educative. Kudos, Yaba Voice. Damilola says, learned quite a deal of knowledge today. Living in the present is one of the key to overcome depression. And I quite agree. We cannot begin to borrow trouble. You know, somebody says worry is like borrowing tomorrow's trouble. We don't even know what tomorrow holds, and then we are borrowing the problem. So living in the present helps us to be able to overcome depression. Onitilo says, indeed, the burden is much. The speakers are doing justice to this topic. Thank you for the insight. Thank you so very much, ma. Who do we contact to make referrals? I'm going to send that information on this platform before we end this webinar. I'm going to get it and send it here on this platform before we do that. Yes, the link will be, we have a YouTube page. The Yaba Voice has a YouTube page. You can access this webinar as well as the very many other webinars that we have done in the past. They are all there on the webinar. All right, so yes, thank you, Yaba Voice from Kende Logo. Thank you so very much, Ma, for being there. With this, I think there should be more awareness about this. A lot of people do need help. Yes, I understand that. And incidentally, you will be surprised that with this, quite a lot of people are also not aware. Because when you get into the interior, you get into those places, people are not knowledgeable about mental health issues. You will see the struggles and the challenges they do before eventually being referred to this place. And that's why we need to keep talking about this over and over and over again. And so that's why each time we send posters, anything now, please help circulate as wide as possible so that more people will be informed. You know, it just takes one person to be informed and then they're able to pass the message across to people. Now, let me just go back to this topic of discussion. Okay, Franklin, no, you cannot speak on this platform, but you can send your comment and then I will be glad to read it out or to just take on whatever it is that you have to share with us. All right, thank you so very much. So, Mr. Kikun Francis, we know that we spend a greater percentage of our time too at the workplace. And 8 hours a day coming to work every day is huge. It's a very huge part of our life. How can we also improve our emotional health, especially in the workplace? Don't forget the stress that we have to combat with to get to work every day. I don't know if I should say this on this platform. Let me just keep quiet. But I'm thinking that maybe the weekend would start from maybe Friday. No, it won't start on Saturday again. But the traffic, the workload, and every other thing. Dr. Libriton mentioned the fact that quite a lot of people are traveling, and that means that a lot of the responsibility is being left for few people to handle. How can we ensure that we have the best of mental health when we talk about the workplace? Thank you, sir.
Thank you, Mrs. Akintoye, for that question. How to improve mental health awareness at work. It is important for organization to have a unit within the organization that is specifically earmarked for staff to come to check about their mental health. Not only for staff, also including the families of staff. Such a unit should be staffed with mature and well-trained mental health professionals who understand confidentiality, and such individuals should be well remunerated. The management should create awareness about such services in the organization. Service consumer from this unit will sensitize others about the service provided. With this kind of arrangement, it is going to go a long way for each of the staff who has one issue or the other to come to the place to hear their concerns, and the therapists in such units will address the issue adequately. Another way is creating an environment that encourages open discussion about signs and symptoms of mental health issues, as well as challenges employees face battling with their mental health. We'll encourage others to share their own experiences and hence increase the awareness about mental health issues. So the organization should create an enabling environment whereby people can freely discuss about their mental health. They can air their mind, they can discuss freely without being sacked, without being punished. And this will go a long way in improving the mental health of people. Then organizing seminars and workshops among employees on mental health challenges will also go a long way. Such seminars and workshops could be moderated by mental health professionals, where staff will learn about mental illness, its causes, signs, and symptoms. And this will also go a long way in helping them. Now, employers and supervisors must create friendly and conducive work environment for their staff, as well as prioritize their staff mental health in their employee and employer relationship. The work environment should be devoid of bullying, sexual and emotional abuse that could trigger mental health challenges. Employers and supervisors should be emotionally sensitive when relating to their subordinates and factor in their mental health condition and mental health status. This will go a long way in helping staff to be mentally healthy at work. Now, during orientation program for new employees, the issue of psychoeducating or issue of discussing about mental health issues should be incorporated into staff orientation, and it will go a long way in helping them to understand and know more about mental health as well as prioritize it. Now, awareness about mental health issues can be improved with staff-to-staff sensitization program. Each employee could take it as a duty to teach their colleagues about mental health and the way out. Now, the website of organization should contain content and write-up about mental health issues. An employee should be encouraged to visit the site to read new content. Flyers containing signs and symptoms of mental health, ill health, could also be shared among employees to serve as backup to the regular awareness being created. Now, it is also important that to promote the mental health of employees, organizations should organize free mental health regular screening exercise for their staff at work and encourage their staff and their children to participate in this screening exercise. In commemorating the World Mental Health or Staff Week, a program like this can be incorporated, and this will further enhance the mental health and awareness among staff. Destigmatizing mental illness in the workplace, creating work environment where employees can talk about mental health issues openly without fear of being stigmatized or discriminated against, will go a long way. Then finally, organizations should formulate policies that protect mental health status of individual staff and also that will improve their mental health status. Thank you for listening.
Thank you so very much, Mr. Kikumi Francis, for that. And I was listening to him and I was saying to myself, not so many organizations does this actually. And that's why we also have quite a huge issue about mental health, even in the workplace. So it's a circle. Somebody is coming from home, burdened, not able to meet up with responsibilities. There are challenges there. And is now also getting to the workplace. And you can imagine the stress from home to the workplace. And also getting to the workplace, and it's also a burden. Yes, it doesn't, it's not like the individual doesn't want to carry on with the responsibility, but the functional ability to be able to just do that is not there. If that is not properly addressed, the individual might not be able to function as well as they should. And that creates multiple problems. And that is very germane to what we are talking about today. And I wish and I hope that we have heads of units, we have people in different organizations here who can also help us to take back this message that when we are talking about raising the stake, it's not just in the community. It's not just the responsibility of the individual. It's a collaborative effort by everyone. That even as an head of unit, as a director somewhere, as a boss somewhere, you also are doing your own bit to ensure that we are raising the stake. Gone are the days when we don't talk about these things. We talk about it in the workplace now. We must talk about this in the workplace. People should be able to talk about the fact that they have mental illness. I don't know if they talk about it. Dr. David, with you, with your people, would they still get them on? Mr. Francis, somebody come in and say, I have mental health issues. Would they be able to say, oh, please, you can be part of this organization? Or the first time they laughed, we were like, it has started, get him out of this place. Now, these are some of the things that we are talking about today. And if we don't address it properly, we would not be able to do so very well. Thank you so very much, Mr. Akikomi Francis, for that very, very detailed and energizing response to this topic. Somebody said, Ganiat Lawal. Okay, no, I've taken that. Lauren Dixon says, thank you. This is so educative. Faith Oppo said, thank you so very much for this information. Please, how can people get financial help in Nigeria for medication for some of these people? I'm going to pass that on to the medical director. He's going to take that as during the end of the webinar. But let's continue. The medical director will tell us how to get money. Me, I don't know how to get money. I just know how to talk like this. But aside from that, I don't know any other thing. So the medical director will tell us about money at the end of this. Anita said, Ma, please, the link. I'm not sure which link you're asking for now, but if you can send in a response, I'll be able to know exactly the link that you're talking about. Ganiat Lawal says, I regret not sharing the link with my contact. I got this morning. I hope we would have it. Yes, we've been doing this since 2020. And it's been going on every month for the past 2 years, thereabouts now. Please, if you could share, I know that some people had made personal requests that they want to be getting our flyers directly. So if you could send your emails, either your email or your telephone contact that has your WhatsApp with me, I can volunteer to be sending the flyer to you. There are people on this call now that I send our flyers to directly every month. So you could share your contact with me. I would volunteer to send it to you as early as possible each time. Yes, so a big thank you to the organizers and the doctors involved. All right, so Franklin says, okay, we need to get the psychiatrists to the local level like primary clinics. We are above 2 million people in Nigeria, and a lot needs to be done by the government to help this happen. So if not for churches and religion, I wonder the state of the human mind. The Lagos state provided a mental health reach out number that is not functioning. I'm very sorry about that. You know, this is not Lagos State, this is federal government. The number that we had shared on this platform today, I am very sure that if you call it, it's going to come true. I'm also going to share the Yaba Voice link line with you, the telephone numbers with you too. So if you don't get through to that one, you can always just get someone. And you know, sometimes network can be funny, but in all of these things, either you get us on the Facebook, the Instagram, or you put a direct call to us. Somebody will always just be there to pick up the call. And then, yes, I know part of what we are doing, and I'm sure that Dr. Adegbite mentioned it, was what she talked about mental health policy, mental health law. You know, when all of these things comes into place, we'll have doctors at the grassroots level that will be able to address all of these things. Onitilo Kemi says you're on point. Atobi Roslin says, thanks to everyone on board. This is educative. I support the push of the mental health institution into the curriculum. That was what Dr. Adegbite said earlier. The other side of the coin is that children may end up educating and helping their parents on this issue. I appreciate that thought. Akiloye said to everyone, kudos to you all. You are really doing well. But it's unfortunate that it's only 2% of Nigeria that are aware of this. And an average Nigeria is not mentally okay. Dr. Bedlington, you will respond to this. Oh, he said an average Nigeria is not mentally okay. Thank God for my workplace. We still have seminar on mental health by a clinical psychologist from last week yesterday. We need more. We really need more awareness in this part of the world. Well done, Yaba Voice. Dr. Adegbite, I don't know where the statistics is coming from, but an average Nigeria, that puts every one of us in the same spectrum. I said, an average Nigeria is not mentally okay. Maybe you should just address this, because I know quite a lot of people are going through stressful situations, and maybe this is a perspective that is making this individual to talk like this. Yes.
Yeah, okay. So talking about saying that an average Nigerian is not okay, I wouldn't know, but I can say that, you know, the prevalence of mental health conditions is on the rise worldwide, not only in Nigeria, in all parts of the world. Yes, I can say that. But according to World Health Organization, it is estimated that 1 in 4 Nigerians has mental illness. So saying that an average Nigerian is not okay, I mean, I don't understand, but that is what I can say. And when we are talking and we're quoting World Health Organization, I mean, that is evidence-based. So I won't succumb to a general assumption that an average Nigerian is not okay. Mental health conditions are on the rise worldwide, and it's a global health challenge. It's a general problem. Thank you.
Thank you so very much, Dr. Adegbite, for that response. But if you look at the 1 in 4 that was talked about, that means about 25% of Nigerians. So 25% of 200 million seems to be having mental health issues. And please, when we are talking about mental health issues, it doesn't also mean that all of them have broken down, okay? One challenge or the other, one difficulty or the other. That's just what it simply means. So please, let's just get this right. Again, somebody is saying mental health screening is a wonderful idea. Yes, that's very, very important. And I feel all organizations should be able to put this into use. Franklin says, please, the constitution needs to be revisited, sorry. Why should someone be arrested for suicide, attempted suicide? Now we'll have to take this to part of policy, because that's what we're talking about, raising the stake. And I think advocacy and all the things are going on about this. And I think very soon we will get it. All right, is it possible for us to get this paper? There is no paper really. The professionals are just talking to us from their wealth of experience. And so please just listen to the audio again. You can take notes just visit the YouTube page of the Yaba Voice. Okay, so Olufumilayo says, good talk. Moses says, talk about it everywhere. Silifat says, oh, kindly note that for public awareness and services, she now gave a number for Lagos State Mind. All right, so please, you can Google this number, or you could look at it. You can Google to read on the mental health by typing Lagos Mind. All right, so there's something that Lagos State is also doing to collaborate efforts on mental health awareness. And talk about, Franklin says, training for everyone is super needed. There is a mental tsunami plaguing the world. That's a very big word. And but Nigeria is still operating. It's just unfortunate, really, really unfortunate. But we will just do our bit to ensure that we stay up there and get everybody informed about what is going on. Emmanuel Nwatu, I will not read your comment because I don't want to be indicted in any way, but we know that we are creating more awareness about all of those things. Everybody needs to be evaluated and assessed so that we can get the best people, not even just into the political arena, but into virtually every available slot so that our world can be better. Do you know that you need to be sure that your partner is emotionally well before you join him or her in any relationship, so that you don't marry a narcissistic individuals and think, oh, this is the best for me. No, this is not just about politics, it's about everything. All right, so Giwa, I have taken notice of your email and WhatsApp. I have saved it. Oh, all right. Ochana, thank you so very much. Damilola, it says this outlook of the country really is a direct reflection of the mental state of the country. Facts not living out. All right, so this is also talking about the political thing. I quite appreciate the concern, really, and I do. But again, we must also be mindful of some of the things I will say here. This is the focus and the emphasis is that we will begin to see how best we can address these issues and make it a better thing. All right, so Silifat again says, if you are an employee of Lagos State, all right, so it's saying this to people who are employees of the Lagos State federal government system. I think we have been able to do something this afternoon in creating more awareness. Go out there, even if you don't know what to say. We are here as professionals. You can invite us, and then we'll be able to respond to your call and send out people to be able to create. We have community-based services that we do at the Federal Neuropsychiatric Hospital, and it's more to create more awareness. All right, so before our presenters will talk about their last state for this presentation, I want the medical director to respond to the issue of finance. How can people get finance for medication? MD, sir, you are the only person that can talk about this. Send it to him. Please send, let the MD be able to unmute himself. Have you seen him? Okay, maybe why that is going on. Dr. Debite, can you just give us your last point on this topic of discussion today, sir? Sorry.
Okay, all right. So before I leave, I want us to know that mental health problem is on the increase worldwide, and a lot of Nigerians don't even know common signs and symptoms of mental health disorders. We have a lot of challenges accessing care. We have problems with funding. We have problems with policies that has to do with mental health problems. And the list is, we can continue to talk about them. However, I want you to know that we still have our specialists around, even though people are checking out of Nigeria every day. But it's also good for us to know that some of these things are not attacks, they're not spiritual attacks, they're actually mental health conditions. And we need to also know that there is no help without mental health.
Mental health. All right, thank you so very much. The MD is here. There is no health without mental health. Even though some of these problems are there, you can also still access help. Medical director, sir.
Yes, without now.
Okay. All right. Sorry, there's still a bit of technical itch there. Mr. Kikumi Francis, can we hear your voice?
Thank you so much, Mrs. Akitoye.
Mr. Francis, please unmute yourself. All right, I think network is just.
Thank you, Mrs. Akintushi.
And I want to, by saying that prevention is better than, cheaper than,
and more economical than cure. Most of those items I have earlier highlighted on improving mental health, I will encourage all our listeners to practice them. Let's practice gratitude. Let's practice connecting with people. Let's practice to be mindful. Let's practice emotional intelligence. It will help us to maintain good mental health. But in a situation whereby we observe signs and symptoms, let's ensure that we connect to professionals, licensed professionals who can work with us to overcome such challenges. Thank you very much.
Okay, all right. So while we're still trying to wrap up, there is a question that just came up. Dr. Gwyneth, I hope you haven't gone. I just want you to take this. How can please can the presenters throw more light on how the public can minimize the impact of political violence and the disaster on their mental health? Maybe Dr. Gwyneth should just talk about this in half a second, but I'm sure the part of what they had talked about today must have addressed this. Dr. Ligbite. Mr. Francis, are you on? Please, let's unmute them, please. Let's just leave them unmuted so that we are wrapping up.
Hello,
Okay.
John.
Okay, so how can we help the public to minimize the impact of political violence and disaster on their mental health?
Oh, well, I think as much as possible is good we keep a positive mind. And again, on the part of the journalists, they need to know how to spread such information. And again, it's good we know that it's not everything we see online, it's not everything we see on WhatsApp groups that are actually true. We need to get the source of the information, and then we need to be sure of where the information is coming from. And again, spreading information anyhow, we need to also be sure of the source before we transfer the information to other people. But as much as possible, let's keep a positive mind. Thank you.
Thank you so very much. And I recall that Mr. Francis talked about control earlier on. Mr. Francis talked about control earlier on. And so if there are things that we may not be able to control, but manage your mind through positivity, that's important at this point in time in our lives. Over to you, the medical director, sir.
Thank you very much, Mrs. Akintoye. We are very sorry because of these network issues. Some becoming of this program. Actually, when you talk about accessing mental health services, some degree of funds is needed. For those who cannot afford, or those who are pauper, we have what we call Alano Fund. This fund is usually from donations from philanthropists, well-meaning Nigerians, and friends of the hospital of Federal Neuropsychiatric Hospital Yaba. For those who don't have anything at all, provision is made for this group of people to access mental health. Also, we also have some non-governmental organizations who are into taking care of those who are mentally ill on the streets, like the Trinity Foundations. They have a program in place. Whenever they see a homeless person or a homeless mentally ill, they will just instruct us to go and pick them and take good care of them at their own expense, and then also reunite them with their family. So this arrangement is available at Federal Neuropsychiatric Hospital Yaba, but the fund, the resources is very, very minimal. On the issue of political disasters and mental health, as we all know, and that is why we want people to guide their mental health jealously. During this period of political era, don't make enemies. Try as much as possible to limit your participation or getting involved mentally, okay? So this will go a long way to really help us. And then also, we will also encourage politicians not to be engaged in any events that can create chaos, that can take life, or that can create violence. All this will go a long way to really help us to maintain our mental well-being. So I want to thank Kemi Akintoye for this program and all the presenters, as well as all the participants far and near, both in Nigeria and outside Nigeria, on this platform for joining us on Yaba Voice for this month. We thank you. Next month is another time. I will be expecting to see you. Thank you and God bless you.
So on behalf of everyone here, thank you so very much. The recorded version of this webinar will be uploaded on the YouTube page of the Yaba Voice. So you could just check it out. Yaba Voice, one word. Yaba Voice, one word. You will see the recorded version, as well as all the previous episodes of the Yaba Voice webinar. It's there. Please, I have one big announcement. On the World Mental Health Day, which happened on the 10th of October, we also had a book launch by the medical director. And the book is also very germane to what we're talking about today. The book is about resilience. We're talking about resilience in surmounting adversity. Please, I would encourage encourage you. Get this copy. So much wealth of experience and everything went into writing this book. And we cannot but talk about resilience in this time. Life is throwing us, and it looks like it's just out of control. If there's anything that would help us to be able to bounce back and be able to stay functional and maintain our mental health, it's resilience. So please get a copy of this. You could link up with the first contact I sent earlier, or you could also send a message to the Yaba Voice line. I had put that on the platform too. So send a message and then we'll get the book across to you. Just let us know how and where, and then we'll have discussion about how much is it, and then we'll get it to you. So on this final note, I'll say thank you so very much for being on this call with us again. Until we come your way again next month. Thank you, Dr. David, Mr. Kikumi Francis. Thank you so very much for doing justice. No, it's not an e-book. Maybe, yes, we will look at getting into the e-version. The medical director is here, he's also listening. And so we'll get it into an e-version that is also sellable. But right now, it's an hard copy. That's what we have. So now, Top Peters, thank you. Thank you so much, everyone. Until we come your way again, please stay blessed, stay safe, and ensure that you keep your mental health functioning. Bye.
Thank you.